Okay, go ahead and take a deep breath. Feels simple, right? But what if I told you that how you take that breath could be silently, reshaping your face, messing with your sleep, and affecting your health in a huge way? Today we're going to talk about the airway's hidden impact. So let's just get into it. You've probably seen a child who always seems to have their mouth hanging slightly open. Or maybe that's you. Maybe you're the one waking up with a super dry mouth every morning. It's so easy to just brush it off as a bad habit. But what if it's actually a warning sign for something much, much bigger? And this is going to sound odd, but the way we breathe is literally powerful enough to sculpt our bones. I mean it. Chronic mouth breathing can actually redirect the growth of a child's face and set off this whole domino effect of health issues that can follow them for the rest of their lives. So let's get into the science behind this. What is actually happening when our most basic fundamental function, breathing, goes a little erratic? Well, there's actually a medical term for this look. It's called adenoid facies. And no, this isn't just a random collection of features. It's a recognized clinical pattern, and it all points back to one single root problem: a blocked nasal airway that forces a person to breathe through their mouth all the time. So what are we looking for? The signs are literally written all over the face. We're talking about a long, narrow facial structure, that classic open-mouthed look. And on the inside, the roof of the mouth becomes really high and narrow. You might even see those dark circles under the eyes. They call those allergic shiners. And a jaw that kind of looks pushed back. And all of this leads to one of the most common signs: crowded teeth. So how on earth does this happen? Honestly, it all comes down to the tongue. See, your tongue is supposed to rest up against the roof of your mouth. It acts like a natural support system, guiding your upper jaw to grow nice and wide. But when you have to breathe through your mouth, your tongue has to drop down. Without that support, the jaw just doesn't widen properly, and it kind of collapses inward, leaving zero room for the teeth to come in straight. And here you can really see the two paths side by side. When you're nasal breathing, your tongue is doing its job. It's like a natural palate expander, guiding everything to grow correctly. But the second mouth breathing takes over. That whole system gets thrown completely out of whack, and facial development goes down a totally different and dysfunctional path. Okay, so if that's the problem, how do we actually figure it out? It takes a whole new way of looking at things. A modern airway-centric approach that's all about finding the real root cause. And this is philosophy that we practice here at the clinic. Instead of just treating the symptom like crooked teeth, practitioners like him are asking why the teeth are crooked in the first place. Is the main driver a sleep breathing problem? Is it related to the jaw joint or TMJ? Or is it a muscle habit thing? Finding that dominant driver is absolutely the first step to a real lasting fix. And this isn't just guesswork. At the clinic, there's a real structure to it. All starts with really detailed questionnaires about sleep, about health, looking for any red flags. Then they do what's called a myofunctional evaluation, where a professional literally assesses how the muscles in the mouth and face are working or not working. And finally, they actually look at the breathing itself, how you're breathing all day long. And to get even more precise, clinicians can use some really cool advanced tools, like something called capnography. Basically, it gives them a real-time report on your breathing chemistry. It measures the carbon dioxide in your breath and gives hard data on how efficient or, inefficient your breathing really is. So what's so great about this? While this little device uncovers all these hidden patterns, it can show if you're subtly overbreathing, which can make you feel anxious or tired. It can spot if your breathing rhythm is unstable. And this isn't just data for the sake of data. It gives a super clear objective roadmap for how to retrain your breathing and get it back to a healthy pattern. All right, so once the root causes are all laid out, the focus totally shifts to treatment. And the goal isn't to force change. It's about gently retraining the body to do what it was designed to do in the first place. And a really key tool in this retraining process is often a specialized appliance you wear in your mouth, like this meiosis system you see here. It's not some aggressive retainer trying to force teeth into line. It's more like a gentle guide that helps correct the bad habits that caused all the problems to begin with. And this is brilliant. This slide shows you exactly how it works. See, the appliance encourages your lips to stay closed, which naturally pushes you to breathe through your nose. It also has this little tag that teaches your tongue, almost instinctively, to go back to its proper resting spot on the palate. So it's not just moving teeth, it's reprogramming your muscles and fixing the actual root cause. And what's great is that this approach works for pretty much any age. There's a Myosa for Kids system, which is designed to step in early and guide healthy growth from the get-go. And then for adults, there's a version that specifically tackles that complicated link between the jaw joint, the TMJ, and breathing and sleep issues, which of course brings us right back to that initial diagnosis. The treatment plan is completely customized based on that really thorough assessment. The practitioner decides which road to take. If sleep is the biggest problem, they start there. If it's jaw pain, that's priority one. It's all sequenced to meet the patient exactly where they are. But look, an appliance on its own is almost never the whole story. To create real lasting change for something as basic as breathing, well, it really truly takes a team. The thing is, your mouth and your airway don't just exist on an island. They're connected to your entire body, and so the way you treat them has to reflect that reality. It absolutely has to be a team effort. So who's on this dream team? Well, you'll have an airway-focused dentist leading the charge, but they're working super closely with an ENT to make sure there are no physical blockages in the nose. They'll team up with sleep doctors, pediatricians, and even chiropractors to help with posture. But a really crucial player here is the orofacial myofunctional therapist. The easiest way to think about OMT is like physical therapy, but for your mouth, tongue, and face. It's a whole program of specific exercises that are designed to strengthen the right muscles and really lock in those new healthy habits. Nasal breathing, correct tongue posture, and a proper swallow that the appliance helps to get started. So at the end of the day, this big picture airway-focused approach, it does so much more than just straighten teeth or stop snoring. By going after the root causes, it has the power to improve everything from how a child's face develops to an adult's energy levels and just their overall quality of life, which really just leaves us with one final thought. For those chronic allergies, the restless nights, the crowded teeth, or that fatigue that just won't go away, could the answer be hiding in plain sight? And something as simple as the way you breathe. It might just be the missing piece to your family's health puzzle.